The health risk of smoking. Smoking kills around 440,000 people in USA each year. Of those deaths, about 220,000 from smoking-related cancers, 120,000 from cardiovascular disease, and 100,000 die slowly from emphysema and other chronically related lung diseases. Cigarettes contain more than 4,000 chemical compounds and at least 400 toxins substances. When you inhale, a cigarette burns at 700 Celsius at the tip and around 60 Celsius in a core. This breaks down the tobacco to produce various toxins, and smoking is very bad for you. It's very bad for your health as it causes cancer and emphysema. Smoking causes more than 11 types of cancers, including cancer of the mouth, bladder, pancreas, kidneys, esophagus, stomach, and the liver. Smokers get tired of hearing it, and physicians get tired of saying it. But make no mistakes. It is so very important. In fact, the American Heart Association declares that it is the single most alertable risk factors contributing to early death in USA, accounting for 400,000 deaths annually. It has been estimated that about half of the smokers will be killed by their habits and that a person in their 20s will live 1/4 less than a non-smoker of the same age. You can eat 5 portions of fruit and vegetables a day and exercise regularly, but healthy behaviors means little if you continue to smoke. The message that smoking is bad for you is the old one, so not everyone gives the full attention. As a cigarette burns, the residue are concentrated towards the butt that produce very toxic and most damaging substances like tar, which is carcinogenic substance that cause cancer. Nicotine is addictive and increase cholesterol level in your body. Carbon monoxide reduce and oxygen also reduce in the body, and components of the gas and particular phases cause chronic obstructive pulmonary diseases. The damage caused by smoking is influenced by the number of cigarettes you smoke, whether the cigarette has a filter, how the tobacco has been prepared. Smoking has many adverse reproductive and early childhood effects, increasing risk for infertility, premature delivery, stillbirth, low birth weight, sudden infant death syndrome. Smoking affects how long you live. Researchers have shown that smoking reduces life expectancy by 7 to 8 years. Of those, 300 people who live every day in USA as a result of smoking will develop different complications, and compared to young smokers, they're also going to be diagnosed with cardiovascular diseases. But I will talk about that subject a little bit later. The number of people under the age of 70 who died from smoking-related diseases exceed the total figure for deaths caused by breast cancer, AIDS, traffic accidents, and drug addiction. Non-smokers and ex-smokers can also look forward to a healthier old age than smokers. Compared with non-smokers, smoking is estimated to increase the risk of coronary heart disease by 2 to 4 times, stroke by 2 to 4 times, men developing lung cancer by 23 times, women developing lung cancer by 13 times, dying from chronic obstructive lung disease such as chronic bronchitis and emphysema by 12 to 13 times. Smoking and cardiovascular disease. Smoking causes coronary heart disease. and is the leading cause of death in United States. Cigarette smoking causes reduction of circulation by narrowing the blood vessels, arteries, and puts smokers at the risk of developing peripheral vascular disease. Obstruction, which is obstructions of the large arteries in arms and legs, that can cause a range of problems from pain to soft tissue gangrene and loss of tissue. And I was going to talk about this problem a little later, which is right now. And recently, actually, to our lab presented young male, 44 years old, and he was complaining about pain after walking 1 to 2 blocks. And after walking those couple blocks, he could not walk anymore and he had to stop. So his physician referred him to our vascular lab where he was evaluated, and he was diagnosed with total occlusion of his 2 major arteries in the legs. And he was also referred to vascular surgeon, and the vascular surgeon, after evaluating the patient, also diagnosed him with the same occlusion, and he was then referred to consultation for preparation for surgery, bypass on the femoral artery. And surgery like that is not always successful, and we see in our department so many times patients undergo 2 to 3 times vascular surgeries, and they are not successful, and after a couple months they end up losing both of the limbs. Being 44-year-old and sitting on wheelchair because of smoking, it's definitely not something what you want to look up to. Smoking also causes abdominal aortic aneurysm, which is swelling or weakening of the main artery of the body, the aorta, where it runs through the abdomen. For men in their 30s or 40s, smoking increases the risk of erectile dysfunction by about 50%. Thinking about quitting, as well as reducing your risk of getting smoking-related illnesses, there are other benefits to quit smoking. General health improves. Tiredness and headaches can be linked to smoking. Your sense of taste and smell improve. The heart will be less strained and work more efficient because the benefits being immediately in 20 minutes, blood pressure and pulse return to normal, temperature of hands and feet return to normal. In 8 hours, carbon monoxide levels are already back to normal. In 24 hours, walking becomes easier. In 2 weeks to 3 months, circulation improves. Lung function can increase up to 30%. In 1 to 9 months, coughing, sinus congestion, and shortness of breath decrease. Cilia regrow in lungs increase the ability to lungs to resist any infections. In 1 year, your risk of heart disease is 1/2 of what it was 1 year ago. One thing is certain, cigarettes snuff out life at an alarming rate. Statistics tells us that upwards of half of long-term smokers will die a smoking-related death, and globally that presently translates to nearly 5 million deaths a year. Put it another way, someone loses their life to smoking every 8 seconds somewhere in the world. Thank you.